Good morning, everyone. This is Bill Keegan, Town Manager in Foxboro, with your latest COVID-19 update. So this morning, the number is we're at 91 confirmed cases, which is that has occurred since March 15th. Right now, there is total recovered of 63 people, and right now we have current active cases of 21 in Foxboro. So they were lost to a follow-up. We've lost 7 people to the follow-up process. So right now, but the key thing is that we currently have only 21 active cases in Foxboro. Total negative cases that have been tested is 448, and total hospitalized currently remains at 3. And then we've had one person who has passed away as a result of the COVID-19 complications. So again, a total of 63 people have recovered, total of 91 cases from the very beginning of March 15th, and 21 cases currently active in Foxboro at this time. All right, let's move on to the statewide numbers. And right now there are 72,025 cases as of 4 o'clock yesterday afternoon. Total of 339,000, almost 340,000 people have been tested. And as far as Norfolk County goes, we are looking at 6,610 cases, and 596 people have passed away. Interesting to note that Massachusetts continues to remain one of the more active states in terms of COVID-19 impacts. Right now, there were 18,300 COVID suitable beds. 3,436 people are occupying those beds, which is a downward trend, by the way. That's actually down since yesterday's numbers. And the number of people in ICU have dropped rather substantially as well, down to 852 people currently in ICU as a result of COVID-19 here in Massachusetts. So that's a good trend to see that happening at this point in time. Let's take a quick look at the report for today. It looks like that there has been some confusion about the update on essential business orders that occurred this past week. The following is just some of the guidance from the state that we've received, and there are several questions that we can help you with. First is, can non-essential businesses stay open if they shift to exclusively curbside pickup? The answer is no. Can employees of non-essential businesses still come in to do non-essential work? The answer is no, unless the business and its employees are following the guidelines of remote fulfillment spelled out below. Can non-essential businesses bring in a small number of employees in order to remotely fill online or phone orders? The answer is yes, if following the remote fulfillment guidelines, which are listed below. It says facilities must be closed to the public as the allowance is for the fulfillment of remote sales orders only. Employees may only be engaged in the packaging and delivering, shipping of phone and online orders, not manufacturing of those products. Operating hours must allow for sufficient ongoing off-hour sanitation / cleaning. All employees must wear face coverings while on site. All employees must maintain a 6 feet social distancing, and employers should stagger employees within the facility to ensure social distancing. Any deliveries made by employees must be no contact deliveries. Items must be left in mailboxes, mailrooms, garages, lobbies, at doorstep, or similar no contact drop-off points. Employees must stagger shift start / stop times and break / lunch times in order to minimize contact. Facilities must have readily accessible hand sanitizer and hand washing facilities for employee use. And facilities found in non-compliance with this order must be closed immediately. Facilities unable to fully comply with all these parameters shall not operate. For the full guidance, you can visit mass.gov/info-details /COVID-19 essential services FAQs. Governor's order for wearing face masks is now in effect. Here is some information related to that order. The fit of face coverings should be as follows: fit securely and comfortably against the side of the face, be secured with ties or ear loops, allow for breathing without restriction, and be able to be laundered and machine dry without damage or change of shape. Exceptions for wearing face masks include situations that may inhibit an individual from wearing face masks safely. They may include, but are not limited to, those who cannot breathe safely, those who, due to behavioral health diagnosis, are unable to do so, those communicating with people who rely upon lip reading, those who require supplemental oxygen to breathe, and those who are exercising outdoors and are able to keep physical distance from others. Just some of the MRC emails. When is the state going to reopen? Massachusetts is currently operating under a stay-at-home advisory until May 18th. This policy is based on guidance from top public health and medical experts, who in Massachusetts are some of the best in the world. They continue to advise the governor and support evidence-based responses. The governor has stated that there needs to be, sustained downward trend in key indices before we can move forward with a reopening plan. Federal guidance requires 14 days of downward trajectory and reported cases and symptoms, along with clear and robust planning for testing, contact tracing, and worker safety. The Massachusetts COVID-19 hospitalization numbers have been a metric that the Secretary of Health and Human Services has highlighted as a key indicator trend. During our surge period, hospitalization numbers peaked around 3,900 patients, and although recent data has shown a net decrease in hospitalizations, we still have over 3,500 patients hospitalized with COVID-19. Recent day-to-day data have seen flat numbers or slight increases, so this isn't yet a sustained downward trend. Massachusetts has been hit disproportionately hard by the pandemic. CDC reports we are currently number 3 in the country for the total cases and number 4 in the country in total deaths. When we start to see news of other states and countries implementing reopening plans, it is important to remember that some areas of the country have not been impacted as greatly as we have. Policies that we adopt in Massachusetts are a direct reflection of the responses to our unique circumstances. While the Reopening Advisory Board hasn't yet issued their recommendations for a reopening plan, an extended period of widespread mask use will likely be part of any plan that's eventually adopted. And just so folks in Foxboro are aware, we are absolutely working on our reopening plans as we speak. Below is a summary of the most recent efforts to respond to the wide range of needs of our communities. For a summary of previously issued guidance and state restrictions related to coronavirus epidemic, you can visit mass.gov/coronavirus. And some of the state numbers, I'll go over them real quickly for you, and I'm going to wrap it up here. I'm somewhat on the time limitation this morning, unfortunately. There are 72,025 confirmed positive cases of COVID-19 in Massachusetts, with over 1,754 new cases and 4,420 deaths as of today as of yesterday at 4 p.m. Overall, over 339,000 cases have been conducted. Tests have been conducted by public and private sources. 28% of those 6,290 tests reported today were positive. 3,564 individuals are hospitalized with COVID-19 statewide, an increase of 22 from yesterday. The Department of Public Health has regularly released daily reporting dashboards containing detailed information on hospitalizations, demographic data, and county-by-county breakdown of cases. As of yesterday, the Commonwealth has a 52% vacancy rate. I guess is 52% of the Commonwealth's 18,300 permanent and temporary hospital beds are available for new patients if needed. Personal protective equipment, PPE distribution continues across the Commonwealth, including 292,000 N95 and K95 masks, and 136 ventilators were issued yesterday. Mobile testing, the Mass National Guard mobile testing unit continues to visit and conduct tests in the Commonwealth. Long-term care facilities having made 569 visits and conducted 31,851 tests as of 5/6. Those are the key items that I want to report to you today. And again, just the state of home advisory is still in place until May 18th at least. The face covering is advised for everyone to wear if you're going to be in a place where close proximity to anyone else, and so we want to make sure you get that. You follow that as needed. I will say that a couple of things that I wanted to make mention of this morning. Give me 1 second here. Let's see. There was one thing that I wanted to make mention of yesterday, and that there was The Council on Aging is doing weekly Zoom meetings for seniors to join them and talk. They had 12 people yesterday. It was actually pretty fun from what they said. Additionally, once a week, they're having a guest host for bingo on Mondays. Yesterday was Morgan Diezik, who was a Patriots cheerleader. And finally, it was worth noting that they are working with the help of Mike Weber from Foxboro Cable to deliver all the virtual programs. And with unlimited technology available, they're doing a really great job of doing that. So the virtual activities with the Foxboro Senior Center include Monday 9:30 a.m. senior Zoom session, Mondays at 11:45 reverse the aging process, Tuesdays Zumba Gold at 9:45, Wednesdays at 9:30 Facebook live chat with Mark, and Fridays at 10:30 a.m. is yoga. Monday through Friday at 1:30 p.m. is bingo. And if anybody has any questions or they want to find out more about what's going on with Council on Aging Human Services, you can go to their Facebook page, or you can email Mark Craig at mcraig, MCRAIG at foxboroma.gov for instructions on how to play electronic teleconference bingo if you so choose. That's some of the latest information we are putting out. Also, just a reminder that the election day is June 8th, and also that town meeting has been scheduled for June 15th. You might want to tune in Tuesday night to talk. The selectmen will be talking about possible relocation of the town meeting to a new venue, and we're working on those details as we speak. So if anybody has any further questions or things that they want me to share on this Facebook Live broadcast every morning, feel free to share with me at wkeegan at foxboroma.gov. Until then, and I'll see you again right back here tomorrow morning with further updates. Hope you're all doing well, and hope you stay healthy. Trying to enjoy the good weather that we're having today, and hope you all stay well until I see you next time. All right, take care now. Have a great day.